I will keep referring to the podcast, and in there you did say that there are some lessons that you've learned throughout this entire experience and that maybe some people could learn from them as well. Would you care to share those?
I'll share some of the most important lessons, a couple of them. The first is listen to your body. We often don't. You might have a niggling feeling. You might think, okay, this is a flu symptom that I have. I'll be able to manage. Let me just take some hot water and honey and I'll be okay. You've got to listen to your body. A second message is a complicated one. You've got to engage your medical professional that is attending to you, even while recognizing that you are not an expert. I've got a legal and philosophy background and my career is in journalism, so I'm not a medical expert. But it doesn't mean I don't have a brain. And so there's a balance in the doctor-patient relationship that we as normal lay people who are not experts must get right. When my doctor did not administer a test for COVID-19, I should have had the conversation with him earlier in the week. We lost 4 or 5 days. That's enough time to die. So you've got to ask questions of your doctor, of a nurse, of a healthcare worker, and say to them, Doc, I know I normally get tonsillitis, but this feels different. Is there another diagnostic test we can do to just test for something else? Then, I know not everyone who's watching can afford this, but if you do get COVID-19, it really is important to go to a pharmacy and buy an oximeter. Your saturation levels, and I know it's a technical term, but the pandemic demands that we learn this terminology. The amount of oxygen that you have is crucially important so that you can know when you need to get emergency medical help. And then it's important to get vaccinated. I can't stress that enough. I know that there is global inequality in terms of the distribution of vaccines, and the global north have been hoarding the vaccines. And slowly in Africa, we are getting the amounts that we need. But when you get an opportunity, your best protection currently is to be vaccinated.
One of the lessons you spoke of on your podcast was, engaging your doctor and, not trying to be like Dr. Google. But seeing as you are also prescribed a medication that is highly controversial, where as a patient do you draw the balance in, letting your doctor do that job, but also not being so complacent and, so ignorant of some of the things that could literally put your life in danger?
I think as a patient who is not a medical expert, it is very difficult to have a robust conversation with a healthcare worker. Precisely because as an expert, you should always have humility. If I'm a legal expert and you are not, you should come to a debate with humility. If I have a philosophy degree and you don't, and we're having a philosophical engagement, you should come to it with humility. But humility doesn't mean that you don't have a brain, you don't have the ability to process information, and that you can't see what is going on within the scientific community. So when it comes to this particular drug, the experts disagree. What do you do as a layperson when the experts disagree with each other?
Yeah.
My doctor thinks that drug works. My pharmacist agrees with him, actually. A specialist physician friend of mine agrees. But my friends who are scientists working on medicine say, don't take it. What do? The quickest way to take a decision is to ask what the regulatory health authority in your country has approved.
Getting to where you are now, which is in good health, was helped by you seeking out different medical opinions, after your diagnosis. But like you said, that also led to it can lead to some sort of decision-making paralysis. So how can one make a well-informed decision with all of that information, but also bearing in mind the time sensitivity of the matter? Because time is of paramount importance when it comes to this disease.
The problem is when the doctor says to you, you are COVID-19 positive, you don't have the luxury of time. It's not a university seminar. With every minute that's passing when you're not taking the drug, the virus is replicating in your body. So the first thing I want to agree with you that you've nailed is time has got a medical consequence when time is ticking away while you are trying to make a decision. So I accepted that I'm not in a position to judge the efficacy of this drug, but that it's my body, that I've got autonomy to my body, and that I will ask several professionals, and then I will make a judgment call based on what most professionals say. And I knew that time forces me practically to make a judgment call. And I made the judgment call a couple of hours after he had given me the script, that I'm not going to take it, but that I will also not ignore the fact that the virus is replicating, and that I will rather consult with a different healthcare provider.
Yeah.
And so the doctor that treated me in hospital, a pulmonologist, was not my GP, was not the specialist physician friend. It was someone who had ICU COVID-19 experience as an ICU doctor. He did not agree with the ivermectin, and he explained to me of the alternatives.
I'm glad that you've brought up the issue of body autonomy, and I want us to talk about it as regards getting vaccinated. How are we going to be encouraging people to get vaccinated as the best option to, survive this disease without necessarily encroaching on that right to body autonomy?
This is a fascinating question, the question of the respect for personal autonomy. And we classically tell people decisions that you make about your body are all up to you. And so the government has emphasized the fact that it's not legally compulsory to get vaccinated, but we'd like you to get vaccinated, but it's your choice. Choice. Now, as a liberal myself, I normally would scream from the rooftops about choice, personal freedom. But I think that that's misplaced. I think every person watching this conversation between us has got an ethical duty to get vaccinated. Because unlike, for example, drinking alcohol, where only you and your liver that will be gone, there are consequences around you if you don't get vaccinated. So, for example, we know medically that if you are unvaccinated and you get COVID-19, that you have more of a viral load than someone who is vaccinated and has COVID-19. And therefore, you are statistically more likely as an unvaccinated COVID-19 positive patient to infect many more people than a vaccinated COVID-19 positive patient. And in that sense, choosing to not get vaccinated isn't just a personal decision. It's a decision that has got implications for society and people around you.